cancer affects all of us. Mothers, daughters, husbands, wives, our children, our families, our friends, and our colleagues. I'm Phyllis Mora, and I'm taking steps against breast cancer.
And I'm Julie Riley. We're the managers of the Palmetto Health Breast Centers on the Baptist and Richland campuses. We're leading the effort to recruit others in the Palmetto Health family to walk or run in the Foundation's Walk for Life and 5K Race for Life.
We're proud of our breast centers, and you should be too. We were the first in the state to be fully accredited. We were the first to establish a Nurse Navigator program, a model that's now replicated across the state. We diagnose more breast cancers than any other hospital system in the Southeast. We rely on the Walk for Life, 5K Race for Life funds to do all this.
This year's walk and race will be held Saturday, October 1st in Finlay Park. Every penny will stay in our community at Palmetto Health Breast Center and allow us to provide the very best care to those families in our community who are facing a breast cancer diagnosis.
My name is Evelyn Martin. I am the manager for clinical services, Palmetto Health Behavioral Care. I have been a patient of the Palmetto Health Richland Breast Center for 19 years. I had my annual mammograms there. In October, I had my annual mammogram, and I was called back for a repeat diagnostic study. Dr. Cromwell and his staff were very supportive, so when I did get the biopsy and it was positive, I was somewhat prepared for that. The team that I met with, Dottie, the nurse navigator, Dr. Sweatman, Dr. Bower, Dr. Butler, all of the nurses and techs in radiology, as well as the nurses and techs in PACU, explained the process, walked me through everything that was going to be happening to me, were very supportive and kind and understanding of my anxiety, and it really made me proud to be a member of the Palmetto Health team. Please join me in supporting the Walk for Life to get the message out to the community and women that early detection saves lives.
Hello, my name is Eligio Colon. My wife, Caitlin Schmidt, died of breast cancer last year. She found out that she had breast cancer soon after the birth of her second child ever in 2005. At the time, she was working as the OBGYN with Palmetto Health Richland, where she kept working until her recurrence of breast cancer in late 2006. She was very worried, but she was very honored and elated to be asked to be the featured survivor for the walk in 2007. She didn't know whether she was going to be able to fulfill those responsibilities. As it turned out, she thrived on the opportunity to share her story and to communicate how important it is to get those annual mammograms and those self-checks at home. Caitlin was very passionate about her role as a physician and her role as a mother. It is that passion that kept her going through the 5 years of her fight, but she died at 38. But because of that passion is that we continue the Walk for Life team that she started, the Cancer Crushers. Last year we have over 40 people, walkers and runners, run with us at Finlay Park. This year we'll be back and stronger. It is a way for us to remember Caitlin and share her story, at the same time helping the Palmetto Health Foundation on its mission, helping someone's mother, sister, or daughter as they go through the terrible news of getting a cancer diagnosis. Your participation will help that mission. Please be there, Finlay Park, October 1st. I hope to see you there. Thank you.
I'm Vicki Bost, a secretary in the newborn nursery at Baptist. 5 years ago, I noticed some external changes to one of my breasts, and I shared that with a coworker. At her encouragement, one night at work, one of our OBGYNs checked me, and he wrote me an order for a diagnostic mammogram and ultrasound. I went to the breast center at Baptist for that, and Dr. Jeanette Fulton told me that she could not find any abnormalities with either of the tests, but because of my symptoms, she suggested that I have a core biopsy. I had that biopsy at Baptist, and everyone was so nice and so considerate of my family and myself, and that biopsy saved my life. I am healthy and thankful to be cancer-free today. Please join me in the Walk for Life on October the 1st. I'm walking in memory of my mother who lost her battle with breast cancer and in honor of all those who have courageously fought this disease.
My name is Melissa Boland. I work at Palmetto Health Baptist. I've been there for 21 years in nursing support services, and I'm their business analyst. I decided to start having mammograms at age 35 because I have a family history of breast cancer. At age 38, my routine mammogram showed a small mass, and I was called back in for a biopsy. In March of 2010, I was diagnosed with breast cancer. When I was first diagnosed with breast cancer, my initial fears were the obvious. Am I going to be okay? What's going to happen to my children, my husband? Those fears immediately went away. But I started to think about my mom and how was I going to tell her? We had just lost my dad, and I just didn't think she could handle any more bad news. I was able to tell my mom, and if any of you know my mom, you know that she's a rock and she didn't falter. No reason to wallow in self-pity. This is just a hurdle, and it's time to just do what you gotta do and get over it. And that's how my mom thinks, and that's what got me through. I was diagnosed with breast cancer on a Monday. By that Friday, I had already met with my surgeon, my oncologist, and had a mastectomy. That summer, I had a hysterectomy and started 6 rounds of chemotherapy. By September, 7 months after my diagnosis, I finished my battle with cancer. I am definitely walking in the Walk for Life this year. Last year, my Palmetto Health family put together a team in my honor called Melissa's Buddies. It meant so much to me. My mom, my brother, all of my family, my kids, they all joined us, and we had a ball. It was so much fun that day. I am Melissa Boland, a Palmetto Health employee and a breast cancer survivor. Please join me on October 1st at the Walk for Life.
Proceeds from the walk and race are used to purchase equipment such as digital mammography and ultrasound units that help detect cancer in its earliest stages. Proceeds also fund services and items that are given to patients, such as the post-mastectomy camisole.
Walk for Life is the biggest event of its kind in the Midlands. It's also a major way that we raise awareness about the importance of early detection. But we need your help. With Medicaid cuts looming, philanthropic support is more important than ever.
We ask you to walk with us. If every employee walked or recruited one friend to walk, we'd more than double the number of participants from 7,000 to 16,000. Wouldn't that be incredible?
We believe it's possible. We encourage you to register today.
Registration is $25 if you register online or use the payroll deduction form. Visit PalmettoHealthFoundation.org for more information.